Basically, as you know, AML is a disease of older patients with a median age at diagnosis of 68 years. And multiple studies, including a large CNGB study, reported dismal outcome in older patients treated without allotransplant. And we have multiple retrospective studies and a recent randomized phase 3 study that was reported at the last ASH meeting in 2022, suggesting an overall survival benefit for elderly AML patients who received allogeneic stem cell transplant and first complete remission. But conversely, a recent prospective observational study done in the US challenged the current practice of allotransplant in older patients with AML NCR1. On the other hand, over time, significant progress in allotransplant decreased non-relapse mortality and allowed the delivery of allotransplant to older patients. However, little information is available about the global impact of these changes and the predictive factors for post-transplant outcome. So we aim to assess real-world changes over time in transplant characteristics and post-transplant outcomes in elderly patients with AML using a large data set from the European Society for Blood and Marrow Transplantation, the EBMT Registry. So our inclusion criteria was first allograft for AML above 65 years of age, performed between 2000 and 2021, so over more than 2 decades, using matched sibling donor, unrelated donor, and haploidentical transplant. So overall, we identified 6,215 patients. So when we look to patients' characteristics over time, in recent years, patients were older, with, for example, a median age at transplant of 68 years compared to 67 for patients transplanted in previous years. More patients are transplanted recently in first complete remission, and more patients are transplanted with adverse cytogenetics. On the other hand, in recent years, we have less matched sibling donors, more haploidentical transplant, and more use of post-transplant cyclophosphamide. So when we looked to the outcomes over time for the global cohort, we noticed a significant decrease over time in the relapse incidence and non-relapse mortality, and a significant increase in leukemia-free survival, overall survival, and GvHD and relapse-free survival. To give you just some examples, the 3-year leukemia-free survival improved from 31% for patients transplanted between 2000 and 2009 to 43% for patients transplanted between 2015 and 2021. Overall survival increased from 36 to 48%, GRFS from 22 to 33%. And in multivariate analysis, the transplantation in recent years was associated with a significant impact on relapse incidence, leukemia-free survival, overall survival, and GRFS, whereas non-relapse mortality was not significant. However, since we have more patients transplanted in first complete remission in recent years, and given the major impact of the disease status at transplant on post-transplant outcome, we looked separately to patients transplanted in first remission, in second remission or more, or with active disease. So for first remission patients, here also we noticed improvement in 3-year leukemia-free survival, overall survival, and GRFS, with improvement in relapse incidence without significant changes in non-relapse mortality. And in multivariate analysis, transplantation in recent years was associated with improved LFS, OS, GRFS, and relapse incidence without significant changes in non-relapse mortality. Conversely, for patients transplanted in CR2 or plus, here also we noticed a major increase or improvement in outcome. Leukemia-free survival improved from 29% at 3 years to 47%, overall survival from 36 to 52%, and GRFS from 24 to 37%. And in multivariate analysis, the decrease in relapse incidence and non-relapse mortality and the improvement in LFS, OS, and GRFS were highly significant. And finally, for patients with active disease, changes over time, there were a trend for improvement, but they were not statistically significant. So in conclusion, this study represents the largest analysis to date assessing trends over time and predictive factors for outcome of elderly AML patient after allotransplant. In older AML patients, despite a staggering 265% increase in the number of patients over 65 compared to the preceding period, we observed an impressive improvement over time in post-transplant outcomes with respect to leukemia-free survival, overall survival, and GRFS. And this was mostly attributed to decreased relapse incidence rather than decreased non-relapse mortality and regardless of disease status at transplant. So this may reflect a better selection of transplant candidates of older age, as well as the increasing use of prophylactic post-transplant pharmacological interventions, mostly including hypomethylating agents or FLT3 inhibitors. And in the most recent period, 2015-2021, the rates of leukemia-free survival and overall survival reached 47% and 52% for CR1 patients as well as CR2 patients. And these large-scale real-world data can serve, therefore, as a benchmark for future studies in this setting and indicate that the opportunity for transplant of elderly patients with AML should be mandatory and no longer an option.